oral submucous fibrosis. So we know exactly what is oral submucous fibrosis. According to the classification of the Andrade and Khanna, there are grade 1 to grade 5. It is classified oral submucous fibrosis into. Grade 1 is there is only recurrent stomatitis and there is a burning sensation. In the grade 2, there is a mouth opening which is ranges from mouth opening is ranges from 26 to 35 mm. And there is a marble-like buccal mucosa, which we can see here. Please open your mouth. Please focus here. This buccal mucosa, we can call it as a marble-like buccal mucosa, and the mouth opening is below 26 mm. This case is grade 3 oral submucous fibrosis. In the grade 3, there is a marble-like buccal mucosa and restricted mouth opening, restricted tongue movement, and if you can see the uvula, there is a shrunken uvula. In the grade 4, they are again classified into grade 4A and grade 4B and grade 5. The grade 5 is there is a direct transformation into the malignancy, there is oral squamous carcinoma. Please open your mouth. Here we can check for the mouth opening. Keep the metal scale over the incisal edges of the lower anterior and the upper anterior and check the interincisal mouth opening. This interincisal mouth opening is below 26 mm, means it is grade 3 oral submucous fibrosis. For the intralesional injection, we are using local anesthetics along with the placental extract, which is 2 ml, then hyaluronic acid, which is 1 ml, and the Canacort. The Canacort means triamcinolone, which is a type of the glucocorticoid. Then what is the use of each and every ingredient is like the placental extract. It is the extract which is obtained from the placenta. It contains the vitamins, vitamin B1, B2, nicotinic acid, and the B6, along with vitamin A and vitamin E. They all help into the breakdown of the collagen fibers and anti-inflammatory effect, along with they acting on the trismus, and they help to the open the mouth. Second is the hyaluronic acid, which is 1 ml solution. There is a release of the hyaluronic acid from this that again lead to the breakdown of the collagen fibers. And the triamcinolone, that is Canacort, which is a type of the glucocorticoid. It is the longest acting glucocorticoid. It also help in the anti-inflammatory analgesic effect, and it improve the trismus, means it improve into the mouth opening. So we take the combination of the local anesthetics along with the Canacort and the hyaluronic acid and the placental extract, and we inject into the intralesional, means over the fibrous band. Palpate the fibrous band over the right and left buccal mucosa along with the retromolar triangle, which is exactly present posterior to the lower third molar. Then check for the and then check for the faucial pillars. These are the anterior faucial pillars. These are the anterior faucial pillars and the posterior faucial pillars. Then rima oris, check for the rima oris. Then the buccal vestibule and the labial vestibule, and check for the tongue movements. tongue बाहर निकालिए, यहाँ लगाइए, यहाँ लगाइए. So we can see there are the restricted tongue movements. So we can give the injection once in a week or twice in a week, and it ranges for the 12 weeks, this injection. Sister, there. We take the 2 ml of the local anesthetics. That helps to, क्या हुआ? They are acting as an analgesic and reduce the burning sensation, as this hyaluronic acid and the other content like placentrix, while giving the injection, they may give the burning sensation to the patient. So we are mix it with a local anesthetic. So we make total 5 ml of the solution. Intralesional injection can be used only when there is a grade 2 or grade 3 grade of the oral submucous fibrosis. In case of the grade 4 and grade 5, there are the surgical requirements like a nasolabial flap, or there are the other submental flap required, means the surgery is required. Following the intralesional injection, the physiotherapy is must. Whether you are doing the intralesional injections or you are using any flap, the physiotherapy is the must, or it is a key factor. Physiotherapy, we can ask the patient to take the ice cream sticks and we can keep it posteriorly over the posterior molars and open the mouth. Like if the patient's mouth opening is 26, if the patient mouth opening is 26, ask the patient to open at least 27 mm, keep it for the 1 to 2 minutes and repeat for 2 to 3 times in a day. Then there is other equipment which is called as a mouth gag, we call as a hister mouth gag we can use. With the help of the hister mouth gag, we open the mouth and the physiotherapy must repeat for 3 to 4 times in a day. Now we are giving the intralesional injection exactly over the, palpate the fibrous band over the posterior buccal mucosa and the retromolar triangle. This is retromolar triangle. We are giving very superficially. Aspirate and slowly give around 1 ml of the solution. थोड़ा इधर देखिए. The same thing we repeat over the right buccal mucosa. Keep the needle very superficially over the fibrous band. Aspirate the needle and around 1 ml you can inject. बड़ा खोलिए. These are the faucial pillars. We can inject here also. Before inject, aspirate. So we are done with the intralesional injections. The key factor is the physiotherapy and the supplements like the vitamin A, vitamin E supplements. Repeat the injection every weekly, either once in a week or the twice in a week for 12 weeks. Thank you.